speech therapy role. Number 1, it's not just speech. Speech therapy can be very broad. It's not just speech that we're helping people with. Can be, so for example stuttering, or if somebody's got a problem with their voice, but also communication, so that involves understanding language as well as communicating expressively. We also deal with people who have swallowing problems, so people who might have had a stroke or suffering from cancer, or things that affect their vocal tract and their ability to swallow. We're involved in making sure that what they are eating and drinking is safe and risk-free. Communication can also be non-verbal, so things like gesture, so using your hands. We use pictures and symbols, so their carer or person that they live with might use the pictures and ask, which one would you like to do today? And they can point. So that's another way of communicating. Numero 2. It's not just children. So a lot of people think that we work a lot with children, which sometimes we do, but we can also opt to work with adults. So there's a lot of things that speech therapists can do to help adults who have either had, for example, a stroke or a brain injury that's affected their speech or swallowing. We could work in a hospital, a rehab unit, or within the community. So in the hospital, it's mostly acute patients, so people who have just come in having a stroke or a brain injury that need assessment. In rehab clinics or rehab units, we work mainly doing therapy with those people who might have aphasia, dyspraxia, dysarthria. They might have cognitive issues that we can help with. Within the community, we're doing similar, so we can assess. We do therapy, maybe conversation-based therapy. It all depends on the client and their client's needs. We also work within mental health, so helping those with depression, schizophrenia, personality disorder, things like that, that might affect their expression or understanding of language. Number 3, it's not just one-to-one therapy. I thought at the beginning, when I first applied for the course, that I'd be sitting in a room with a child or an adult doing one-to-one therapy, and then the next person would come in and see me, and that's definitely not what it's like. So you could see people on a one-to-one basis, say in a clinic, but a lot of the time you will be either running groups, you'll be talking to people such as carers. In a school you'd be looking to work with LSAs, the teachers, and in hospitals you'll be working with all sorts of people, so doctors, nurses, dietitians, physios, OTs, literally everyone in the hospital basically, and you'll be working as part of a team, so you aren't on your own, and there's usually lots of other speech therapists that can help you out if you get stuck. Our role also includes training others, so for example with adults with learning disabilities, a lot of the time your aim isn't to improve their communication, you're trying to improve the communication of the people around them. Maybe changing the environment, so making sure that they have the resources that they need for communicating their best ability. Number 4, it's not elocution. A lot of people have asked me, oh, so you're going to help me speak properly. Oh, you're the person who helps me speak posh. It's not really that. It would be the underlying communication problem that we'd be helping with. So we wouldn't be helping, say, businessmen with their interview skills. 5, we don't actually directly work with other languages. A lot of people believe that I can speak lots of different languages because I'm a speech therapist or because I've done linguistics in the past, and that's not the case. We'd only really encounter other languages if that person has English as an additional language. We'd only work with a child of another language when they have an underlying language problem. I hope you enjoyed that video. I'll be doing a lot more 5 things you should know videos, mainly about speech therapy, but if there's anything that you would like to see, so 5 things you should know about, I'm hoping to do one about stroke, one about cancer, one about language delay in children. So if there's anything else, let me know. Give it a like if you liked it, and subscribe if you want to keep up to date with the ones that I do. Bye bye!